Here we go.
Yeah, that was the idea.
All right, this is going to be station 2. This is going to be traction, the application of the traction splint. You're going to do this if you have an obvious femur fracture here. It's contraindicated if you have any other fractures or deformities of the leg. Again, this is only for an open femur fracture that you're going to use this skill for. First thing you want to do is take scene safety BSI.
Step 1, verbalizes or takes body substance isolation precautions.
Scene safety BSI.
Step 2, assess the affected leg, PMS, pulse motor sensitivity.
So we're going to be tractioning this particular leg here. I'll just come up. Can you feel me touching you?
Yes,
Can you feel this?
yes,
Can you feel this?
yes.
And then I'll check for a quick distal pedal pulse.
Step 3, direct your assistant to apply manual traction.
Could you please take up manual traction of the affected limb, please? Here's a cravat if you need it. For this station, you are going to need at least a minimum of 2 cravats, possibly 3.
One cravat's going to get tied either directly above or below the knee.
This?
Second cravat's going to get tied right at the ankle.
We'll loop it through. Make sure you have one end really long and one end really short. You're going to tie it off to a side. For the purposes of this, you would do square knots. Then you would bring it under the leg. Bring it up and through. Bring it back down and around. And for the purposes of this, I am just going to bow tie it.
Okay, and the partner will now take manual traction.
I will then measure the splint to the unaffected side.
That is step 4, measuring and adjusting the splint to the appropriate length.
You want to make sure that you find the bones in the bottom of the glutes to make sure that's where your top piece is going to go. Make sure it's nice and snug, and you want to put it approximately 4 to 6 inches or so beyond the foot so that when you apply your manual traction, it'll actually tighten down. When you're done, you'll come over.
Step number 5, insert splint in positions correctly.
For this step, we're going to open up all your things. If you need to adjust them, your straps so that they're down where they're supposed to be, now would be a good time to do it. So they're about where you want them. This one should be down low, lower leg. This one should be just below the knee. This one should be just above the knee. This one should be here, and then your ischial strap will be on the ischial area. And then we'll stick it in to the affected area. We're going to put some padding down.
Step 6, padding applied under proximal securing device.
You're going to want to pad this area here, making sure you don't lose your strap.
It's loose.
Pull it out through that.
You want to make sure this is up in the ischium as far as possible.
The This is step 7, applying and securing the proximal securing device.
Make sure it's very snug. And then you're going to continue working your way. You're going to secure this to the device first, and then you're going to tighten all the straps.
Applies and secures distal securing device.
Pull the pin to release. Reach up under your partner's leg. And then tightening it down. Making sure there's minimal tension right there.
Step 9, appropriate mechanical traction applied using the splint. Step 10, manual traction is maintained until relieved by mechanical traction. Step 11, support straps fastened and evenly spaced to support the leg. Meanwhile, your partner is stabilizing the limb, making sure that it does not move while applying the straps.
Make sure you get your 1, 2, 3, 4 devices used. If you want to, you can either put this strap here in this area, or you can secure the top strap with an extra cravat.
Meanwhile, making sure there are no straps over the area that is broken.
You want to make sure that it's not in the affected area. You want to make sure, especially for your state exam, that this strap here doesn't come loose. And then you'll direct your rescue to release manual traction.
Step number 12, reassess affected leg PMS, pulse motor
Can
sensitivity.
you feel me touching you?
Yes.
And check for a pulse. 13, verbalize securing of patient and device to a long spine board for transport.
I will secure then my patient to a long spine board.